Let's continue on to our next session. So we're going to be looking at another Canadian initiative helping combat antimicrobial resistance in our great nation, which is entitled AMR Aware Canada, an invitation to help make AMR meaningful. This is presented by Dr. Jason Vanstone and Harpa Isfeld-Kiely. Dr. Vanstone grew up in Regina and completed a BSc in biology at the University of Regina in 2006. He then completed a PhD in cellular and molecular medicine at the University of Ottawa in 2013, where his research focused on regenerative medicine. Following a postdoctoral fellowship in rare disease research at the Children's Hospital of Eastern Ontario, Jason returned home to Regina in 2015. In 2016, he began working with the Regina-Qu'Appelle Health Region, now the Saskatchewan Health Authority, and is currently the research scientist for the Stewardship and Clinical Appropriateness Department. Dr. Vanstone is passionate about educating the public on the threat of antibiotic resistance and improving antibiotic stewardship efforts in healthcare. Harpa Isfeld-Kiely is a knowledge broker with the National Collaborating Centre for Infectious Diseases, or the NCCID, based at the University of Manitoba. Since 2016, she has supported projects focused on antimicrobial resistance, advancing evidence-based antimicrobial stewardship strategies through knowledge translation and exchange initiatives such as the Manitoba AMR Alliance and the CAN AMS webinar series. Also coordinating AMR Aware Canada, a national collaborative awareness campaign for both the public and healthcare professionals. Harpa brings a wide range of experience and interests to her work, including a master's degree in medical anthropology, interdisciplinary research on the social and structural determinants of health, community-driven social policy development, and volunteer roles in community wellness initiatives. Please join me in welcoming them to the stage.
Good morning, everyone, here in Toronto and online. It's great to be with you for day 2 of the AMR Symposium and day 2 of World AMR Awareness Week. And I want to begin by thanking our hosts, AMR Canada and their partners, as well as the AV staff and venue staff, event staff who's been making this all run smoothly. Thank you very much. So as Patrick was saying, I'm a knowledge broker with the National Collaborating Centre for Infectious Diseases, and we're funded by the Public Health Agency of Canada for this work, and we're situated in Winnipeg, hosted at the University of Manitoba in Treaty 1 territory. And but today's talk is not about NCCID. It is about this collaborative initiative we call AMR Aware Canada, and we're very proud to lead that at NCCID. And but I also want to hear from one of our many collaborators. Passing it off to Jason.
Sure, thanks, Harper. Yeah, so my name's Jason. As he said, I'm a research scientist with the Saskatchewan Health Authority, based out of Regina, which is on Treaty 4 territory. Hopefully, no one from Montreal holds that against me, but you know, your football team sucks, so.
Okay, so today is, we have a very simple goal, and it's to involve you all in the AMR Aware Canada campaign. And we'll be asking for your input, so you're already trained on this to use Slido, so get ready either for the QR code on the slide or in the event app under polls. So I think you're already ahead of the curve on this. Everyone in this room cares about AMR. And understands that awareness is really the first step or a preliminary step to action and change. And people in this room understand the importance of getting together, to talking outside your silo, to talking to others across regions, across, we're not talking to ourselves in an echo chamber. So that's really at the heart of this campaign, is working together to inform Canadians about AMR in a way that moves them to act and care. And we want you to be part of that. So here's where we're going. We're going to talk about our story as an initiative, a collaborative initiative, and we're going to talk about some of our hurdles. And take a look at Campaign 2025, and also where we can take it with your input.
All right. So, as Harper said, we want to hear from you guys. So, get on that Slido in the room. We've had some attrition in the audience today, I think, but hopefully online there's still a big presence. We want to know, one word, tell us, why do you care about AMR? So, most of us here are working in this world. What is the thing that comes to your mind? Don't think about it too hard. Gut response. What is it? What do you care about AMR? Give you a second to let those words come up. Death, a big one.
Yes,
right off
that's
the
a
bat.
big one.
Danger, crisis, future, saving lives, threat to our health, antibiotic effectiveness. All right, so we're populating word cloud here, so you can see the big ones with more answers in them. Health security, that's a good one. Super big, running out of drugs, bad.
Sustainability, that's great.
Sustainability, population health threat. Scary, it's definitely scary. I agree with a lot of these. I think for me, the future, I always, when Harpa and I have talked about this, that was something that, I have children, right? And that it's about the future. It's about my children having an opportunity to access these miracle drugs that we've had for, not even 100 years yet, so. All right.
Yeah, that's great.
60 participants, that's great, thanks.
Wonderful. You're hired. Oops, I think I've gone too far. So I haven't. So these themes, your answers, I think they factor and feature largely in the global AMR awareness campaign too. We see these themes picked up on in their campaign material and message they get out every year from November 18th to 24th. We have this campaign, and now I'm going to ask a very straightforward, simple question that this just needs a show of hands. How many in this room have heard about World AMR Awareness Week? I'm going to be surprised if there aren't any hands up, but we've been talking about it, of course. And now keep your hands up if you have participated in World AMR Awareness Week. Fred's the first hand up. That's great. Yeah, so you know that, that this is a global One Health awareness effort. It's led by the Quadripartite, and while awareness is only one part of AMR action, alongside what you do, research, surveillance, innovation, and more, it helps to connect that work to the public we all ultimately serve. So if there's a global campaign, why do we need a campaign for Canada, an AMR Aware Canada campaign? Well, the Wellcome Trust in the UK gave us a hint at this. They did research that was with 12,000 people, which included interviews with experts and media analysis. And based on that research, they put out a report in 2019 called Reframing Resistance. And what one of the recommendations they said was to communicate about AMR with people, we need to emphasize that this is a universal issue, that it can affect anyone, anywhere, because people tend to underestimate that it can affect them where they are. And we're not immune to this in Canada. We do that othering. Well, it's somewhere else and it's someone else. And that insight helped shape the AMR Aware Canada approach. We do align with the World AMR Awareness Week, the global effort, but we focus on messages and resources available and developed in Canada that are relevant for this context and the health systems that we have. And we're really helping to put that relevant material into the hands of national organizations, of local leaders, and to make it real for Canadians. Jason.
Yeah, so we've seen a lot of this information already over the last day here in some of the presentations, but I just want to re-highlight that, there is a reason to do this awareness stuff. We need people to be aware of the issues, the threat that AMR poses to us. And so there was this great report that was produced by the CCA. And I just want to highlight, when academics say things like, when antibiotics fail, it's very rare for academics to make such bold statements. So this is something we should be paying attention to, I think. But they showed in their report, by 2050, we could be looking at 40% rate of resistance, thousands of deaths directly related to AMR, billions of dollars in healthcare costs, and even more billions of dollars affecting the Canadian GDP. So this is a real threat to us as a society. Beyond that, we've seen over the years increases trending up in various antibiotic-resistant infections there. So from the CARS report, you can see all these different types of infections showing increasing resistance and rates of resistance across the country. And there was a survey done by PHAC a few years ago that also highlighted the lack of awareness across the Canadian population. So their survey showed that only 24% of Canadians knew the term antimicrobial resistance. And it's still something that when we do presentations in our program, this is something that people struggle to say, let alone be able to define and understand what it is. From the survey, they also found that there was lots of common misinformation about antibiotics. Almost a third of people saying that they thought antibiotics can kill viruses, which hopefully all of us in this room know is not true. Right? Right. Okay, good. And so also from the survey, inaccurate information more commonly reported by people in the younger age groups, 18 to 24, lower income, and those with less than a high school education. So we've heard about the Pan-Canadian Action Plan yesterday too. We know that stewardship is one of the 5 pillars of that action plan. And one of the outcomes from that pillar is that Canadians will better understand the importance of the appropriate use of antimicrobials. And one of the actions that can come from that is awareness and education campaigns. So we do need to be doing these things across the country in order to make sure that we're reaching these goals that are laid out in the Pan-Canadian Action Plan.
Okay. And we know, I think it's natural for us to turn to our federal government. Where's this campaign? And yet, in 2016, we gathered stakeholders here in Toronto and brought 50 champions of change together. And there was this kind of big call, well, where's the leader and where's a campaign? We need this in Canada. And they pointed out so many of the points that have been raised yesterday, that we mainly have stewardship and efforts in tertiary care centers and hospitals in large cities, but we don't have much in the community, and yet antibiotic misuse is so high in the community. But there's disparities. Regionally, we can't support these kinds of awareness efforts in different provinces. However, we have leading practices. We have Do Bugs Need Drugs, Antibiotic Wise, we have Choosing Wisely. So some of those resources were being highlighted yesterday. And so the group said we need a national platform that could elevate Canadian work and not to reinvent the wheel, but to leverage that. So really we were looking around the room to what can we start right away? What can we start without funding? What can we leverage? And so that initiative, coming back from that really pivotal meeting, we started to grow this collaboration. And it grew sort of like a grassroots effort and today there's over 20 organizations involved, over 50 people that shape an advisory and information exchange network. And this is coordinated by NCCID, as I mentioned. And our program is PHAC funded, and because we're situated in an academic center, we have that neutrality and flexibility that certainly a federal agency leading a campaign wouldn't have. So we're able to convene that national initiative. And last year was a real shift, and we really gelled in our identity by renaming the initiative AMR Aware Canada. We came up with a logo one of which you see displayed here, and the look and a design of a fresh new website. So that was a real turning point for us. And so part of this, of course, involves, as this kind of grassroots campaign, it involves turning to our leaders and experts, to you. And one of the questions I hear often is, can we share this campaign? Are we stepping on any toes? Yes, absolutely you can. These materials are free. This campaign is open to others, and it really is in a collaborative spirit. So we need collaborators. We also need just friends and followers that share the campaign. And an easy way into this is to sign up. It just helps you stay in touch with the campaign. It helps us kind of gauge the interest. So that's something you can do. This QR code takes you directly to a form to sign up and stay in touch. So now I'm going to invite you to be a distracted audience. If you're not already, go to this QR code brings you straight to the home page. So browse there what we have done together as a collaboration, what we provide there. We have a resource repository, we have stories, we have a webinar series that's hosted off this platform. So go and browse.
Yeah, there's all kinds of great stuff on there. So you can sign up for the next webinar. I think Brad's in the room today. He's moderating the next webinar. There's all kinds of cool things. I get to do my Vanna White stuff here. You can find these lovely little one-pagers and great little factoids and things. This was something that we did last year, come up with these 5 things that people wanted to share about AMR. So grab them, print them off, post them in your institutions, clinics, wherever it is that you work. Share this information with the public, with your colleagues, and share it on social media. Use the hashtags to make sure that it's connecting to all the right people and helping to bring this information out there. You can go blue for World Antimicrobial Awareness Week. So Harpa and I are wearing our blue today. I see other people. Cashew's got a blue sweater on. There are lots of people wearing blue in the room. This is a global color campaign supported by the WHO. We've been working on this for a number of years across Canada to try and build and gain profile for this. I think we had upwards of 50 sites in one of the recent years. But lots of things you can do. So obviously wearing the blue during the week, talking about it with your colleagues. You can use some of the backgrounds and things like that you'll find in the webpage for social media, for your video calls and stuff like that. Visiting landmarks. So the CN Tower is going to be lit up in blue here in Toronto and a number of landmarks across the country. So take a selfie, post it on social media, use those hashtags to get the information out there. Yeah, there's your hashtags there. So feel free to engage.
Okay. So let's take a look at the campaign briefly for this year. These are the goals we've been shooting for, and we've been building on that new name and brand that we developed last year to really strengthen and grow AMR Aware Canada this year. We have over 2,000 subscribers that have signed up to reach through a news update, and we've also been strengthening the collaboration by developing terms of reference to clarify why we work, how we work together, and developing some messaging, common messaging for collaborators to help represent us, because we can't travel everywhere. We need our collaborators speaking for the campaign. So we developed some material to help them confidently and consistently carry some message that we do have a campaign in Canada. So we've been working hard also to increase visits to the website. It's also available in French, and increase the number of downloads of either resources in the resource repository or campaign materials to share for the global campaign and for the Canadian ECHO campaign. So we've also, in the curated resources, we're working hard to expand that. It's a continual process where we look to our collaborators, but also take suggestions. There's actually a form on the website that you can suggest a resource that others use. I've been listening for some of the resources those of you are talking about in your sessions. So we get permissions, of course, to use that. It's largely from our partners and collaborators putting forth some of those leading resources. So another goal this year is always we want to explore meaning of AMR. To make it meaningful, we have to have those conversations about the stories of impacts of AMR on patients. We were so happy to hear the patients yesterday. I made a connection with one of the patients to talk about a future story. So we're looking to co-create stories with patients. We've begun more of that. We have some stories featured on the site. More are coming. We're also collecting quotes, started to collect quotes from professionals to also make conversations that are relevant in the professional world. So some of the products for 2025 that are new and help putting these campaign goals into action Some of them you've seen here at the Symposium, a new brochure, a banner sign which has walked off, or it's behind
Around
that
the corner
one.
there, I think.
Oh, yeah. So, yes, so some of that material we'll be bringing out to events, and a little calling card that helps connect with a QR code connects to the site. So as you browse the site, you'll see some of these other items. We have a map of the Go Blue landmarks that are committed to lighting blue for this year. There's over 31 at this point, and I think 9 of them are in the Greater Toronto area. That's a large due to Brad's efforts. And also the webinar series has a hosting page. We have recordings of past events. It's been a great series so far, and one more event coming in December.
So, we know that, as it goes, you can lead a horse to water, but you can't make him drink, right? So obviously awareness and education are only part of this. So how do we get these things to actually work? And we know that, this is thanks to Brad, and he talked about some of this yesterday, we know that their education campaigns, awareness campaigns do have varying effectiveness. So how can you make them better? What's the implementation piece that goes along with that awareness? So things like focusing on key messages, right? Really picking what is it that you want to tell people about this year, and use that as your message to bring that forward. Might be a specific infection. Focusing on respiratory tract infections is usually a good one in line with the winter season in Canada. Wanting to address multiple audiences, so making sure that not only are we reaching out to prescribers, providers, people in the medical health world, but also the patient side of things, right? This is something we need the general public to be aware of so that they can play their part in, pressuring government to do more, in ensuring that they're not putting pressure on providers to give prescriptions where they're not necessary. Active approaches in addition to passive approaches. So it's great to be able to do mass media, patient handouts, sharing things on social media, stuff like that. But really taking an effort to move to that next step and doing, educational interventions in your local area, face-to-face meetings and learnings, so that people can really get more engaged with the information as opposed to just sort of passively coming at them. And then pairing co-interventions, pairing the education stuff with those co-interventions. So we heard yesterday about audit and feedback from a panel, right? So that's a very effective way of bringing this education to a meaningful then intervention. Incorporating clinical decision support tools, we've heard about those, different communication strategies. So finding ways in your local context to take this awareness to the next step is a key piece to making it work.
So those findings that Jason highlighted, we put a lot of thought into that in our campaign among our collaborators. Certainly in the first years, we were emulating the work of Do Bugs Need Drugs, always having multiple audiences, tailoring some of the messages appropriately. We filter our resources by audience type. We're trying to do more to sort of make a composite of here's messages for everyone, here's messages for providers, and prioritize some of the low-hanging fruit of viral infections, the misunderstanding about that, of the causes of infections or the microbes involved and what treats those. So we have thought about that. We're leveraging those evidence-based leading practices. And yet, I also want to be candid with you about some of the hurdles we face and the realities of this campaign. And so these are some of them. So AMR is complex, and explaining it simply can be tremendously hard. I think those signing up for the competition will understand that. And in 2 official languages is even harder. Sometimes we're bringing on contractors and we have to educate them about AMR before we also develop material. So it's a real communication challenge. We also live with a resource catch-22 in our resource campaign. We're using my staff time, we're leveraging other organizations, we lack funds. So we need capacity to grow the campaign, but with limited capacity, it's hard to secure the new resources, to find the time to run the campaign and write proposals and everything. Engaging mass media is very difficult for a slow-moving crisis, and the urgency of AMR does not often translate into headlines. Demonstrating uptake and impact is also challenging, and sometimes when you're recruiting collaborators, it's hard to say, well, they want to say, well, is this likely to work? And what kind of metrics or analytics can you show me? And yes, we have some. But, that attributing success to a campaign, that's certainly, something that would be highly challenging. So we're also working to strengthen regional and equitable representation among our collective. There's certainly gaps in the territorial representation. We have difficulty engaging on an ongoing basis. Some of our collaborators are very busy for this kind of work. So, and finally, social media. It's crowded, it's shifting, people are fatigued, and disillusioned with some particular platforms. We've heard some of that frustration come through in statements that we've made here at the symposium. And it's hard to use it meaningfully and not just add noise and crowd the messages. But this is really underlying this slide is a question to you. How can you help address some of these challenges? Where can you make suggestions? How can you play a role? We're looking for collaborators to help shore up some of these challenges.
Okay, phone's up. Back to Slido. We've got a ranking question here for you guys. We want to know from this list, what do you think are the biggest barriers to engagement on AMR? Obviously, this is not an exhaustive list, but from the ones that we've put up here, let us know. What are you guys seeing? What are your biggest barriers in your work? Or which one of these is your biggest barrier? And so on and so forth down the list. All right, they're doing it. 7 people ranking, 10 people ranking. Distrust of experts, other competing priorities. Yeah, that's a big one, I think, for me personally, too, in my world. Lacking leadership. Other competing priorities seems to stand out. I think anyone who works in a health system will agree with that, right? There's a million things that we need to fix, so how do we get this one towards the top of that list? Generally feeling overwhelmed. Okay. That seems to be the big one that's standing out. Other competing priorities, as well as complexity of the science and distrust of those experts or authorities. Yeah, those probably in the top 3 there are, I think, definitely ring true for me in my experience too. So,
great.
Thank you.
Yeah, thank you. So the campaign, of course, isn't only challenge. Along the way, we've learned what actually helps this work. First, we've learned the lesson that campaigning is a marathon, it's not a sprint. And awareness shifts slowly. We have lessons, of course, from other major campaigns for recycling or seatbelt use. And from those examples, we know that the slow, steady, continual, sustained efforts and some consistent messaging, and from that messaging to be reinforced from many, in many settings by many voices, helps. And second, although we've centered this a lot on the week in November, but we know that we need continual work to really build our collaborative and to think more long-term about what that's going to look like in November. So there's a need for the surge of work and the preparation for the campaign focused in November, but we also need continual work and embedded work in awareness building. So we've made some efforts at that in building the CAN AMS webinar series, more ongoing work, and as well as just that work to get resources into people's hands and to provide that ongoing repository. So third, we understand not to crowd the field. World AMR Awareness Week is a very busy week. We put sort of all the marbles roll into that corner of the drawer of like, a blitz of events and webinars. And so we try to step back and not add to events, but to leverage events like this, to embed ourselves within other events, but also just working through with collaborators, not only during World Antimicrobial Awareness Week. So we also know the importance of building trust. Some of the themes that were coming up in your responses were about trust, the concern about trust. We're working to build trust of our collaborators, but of the community and of the public. So we know that that's a long-term commitment, and it does take time, and we need to be there year after year after year, holding this up, and certainly we put some of our. I think that's the value of this, the power of a collaborative campaign, that we have. The more organizations that we spread this to spread this widely, we engage their memberships and their people who trust them. So we have a little bit of an ability to reach people and to build trust in that way. So we also we adapt to how our collaborators can work with us. Some of our partners have worked with developing games and quizzes and fun things, and others are leading policy initiatives, asking tough questions about AMR and migrants, and so there's many kinds of ways that we can engage, and if we leverage all of that, we also stand to gain from a diverse public audience that can engage with something because maybe they have that interest in the microbiome, and that kind of messaging brings them in. We also understand the importance of daring to be authentic and personal with this work, to coming to an event like this and sharing, frankly, our challenges, and inviting people to help us. The vulnerable asking for help is something that we need to do. And also being personal to bring in personal stories of patients, but also to bring in other voices, like collecting the kinds of quotes, like what it means for you. That's what we're doing here and now at this event. And we want to bring more voices to let those in to speak for the campaign. And I think that's very important.
All right, Slido time. We got 2 more questions for you guys. I think 2 more, right? Yeah. From you guys, what could amplify this campaign's impact? So what have we missed? Who have we not connected with? Let us know. Put those things on here. We'll collect that information so we can take it with us. I'll give you 20 seconds to jump in there. A celebrity story. Yeah, we need like Taylor Swift to get like a real bad AMR infection or something, and then like agriculture and industry. Yeah, that's an ongoing challenge to connect that One Health thing.
Yes.
Influencers. Anyone have a real big following on Instagram that you want to be our first influencer?
Schools, yeah.
Schools is a great one. We love doing presentations to students, high schools in Regina area. If anyone wants slides for presenting to high school students, we can share that with you guys. Okay. Money.
Money.
Yeah.
Yeah.
Yeah, if you have a big bank account. That comes with the celebrity influencers too, right? Taylor Swift, and then she'll bring the money. Okay, one more question. We're going to jump to the next one. We want to get from you guys a sentence now. What is the message, one message that you guys want Canadians to hear? As people working in this field, give us that message. Some of these might even be used as quotes on our website. So
one sentence.
Yeah. No swear words. Public quotes. AMR is real.
This is a PG campaign. Yeah.
I like that. It's everyone's battle. That's always the one that I go to. This is all hands on deck. We need everyone here contributing to fix this problem.
So thanks for joining us today. Thanks for everything you've shared on these slides. We hope to make use of this and dig in. Some thematic analysis will follow this event. And we really, truly do believe that AMR awareness can grow in Canada when we work together. And I'd say don't estimate the power you have, the voice you have within your many circles of your many networks and relationships, in this world, that you have a voice, And as an AMR leader, you will be a trusted resource. And I think that's very powerful. So here are the QR codes once again. Visit the website, stay in touch by signing up, and share the campaign wherever you can. Call out to us if you'd like to collaborate, offer any ideas that you haven't already. Please reach out to me here at the symposium or email me at any time. I want to thank Jason very much for standing up and helping to shoulder this with us. This is an example of one of the great collaborators that we do have. Others are in this room, so thank you.
My pleasure. Thank you. Thank you all.